Preeclampsia is a serious condition that can cause life-threatening complications for both mother and baby. If you think you have preeclampsia or you have symptoms of it and you want more information, then keep watching this video because I'm going to be telling you what causes preeclampsia, how it's treated, and the best way to prevent it. My name is Sweeta. I'm a registered nurse in the LA area, here to share my mommyhood experience with you all. And if you like today's video and you want to see similar content, please hit like, subscribe to my channel, and keep watching. It's estimated that around 5% of pregnant women will develop preeclampsia at some point during their pregnancy. But what exactly is preeclampsia? How does it affect your body? What are some signs and symptoms and treatment for this potentially deadly disease? So let me break down everything you need to know so there's no more confusion about this complex medical condition. So what exactly is preeclampsia? Well, it's a serious blood pressure condition that can happen after your 20th week of pregnancy or even after giving birth. It's when a woman has such high blood pressure that some of her organs, like your kidneys and livers, may not be able to work normally. The blood pressure is the force of blood that pushes against the walls of your arteries. And arteries are blood vessels that carry blood away from your heart to other parts of the body. And so high blood pressure is when that force of blood against the walls of the blood vessels is too high. It can stress out your heart and cause complications during your pregnancy. Preeclampsia is a serious health problem for pregnant women around the world. It affects about 2 to 8% of pregnancies worldwide. In the US, it's the cause of 15% of premature births. And a premature birth is basically any birth that happens too early, before 37 weeks of pregnancy or before the baby is fully cooked. Most women with preeclampsia have healthy babies, but if it's not treated, it can cause severe health problems for you and baby. Okay, mama, do you think you're at risk for preeclampsia? Well, honestly, doctors don't know what for sure causes preeclampsia, but there are some things that may make you more likely than other women to have it. And these are basically the risk factors. If you've had preeclampsia in a previous pregnancy, it's almost for certain you might have it again. So please make sure that you discuss this with your doctor so that you guys can treat it ahead of time. And you're also at risk to get preeclampsia if you're pregnant with multiples like twins or triplets or more, or if you already have a history of high blood pressure, or if you have diabetes or a kidney disease or an autoimmune disease like lupus. And if you've had diabetes or if you have it, you know that that's when you have too much sugar in your blood. This can coincide with high blood pressure as well, because especially during pregnancy, your blood sugars are high, your blood pressures are high, so you can definitely get preeclampsia. Other risk factors for preeclampsia include the fact that you've never had a baby before, or it's been more than 10 years since you've had a baby, or if you're obese, which means your body mass index is higher than 30. If you have a family history of preeclampsia, like other people in your family have had it, like maybe your sister or your mom, or you've had previous complications in your pregnancies before, like having a baby with low birth weight. And low birth weight is basically when your baby is born about 5 pounds or 8 ounces. Or if you've had IVF, or if you're older than 35, if you're African American, and if you have low socioeconomic status, these can be risk factors as well. So please discuss any of this with your doctor to find out more, and don't take any medication until you've spoken to your doctor. So what are some signs and symptoms of preeclampsia? So signs of this condition are more like feeling dizzy or having a sore throat, or changes in your vision, blurriness or flashing lights, seeing some spots or being sensitive to light, a headache that doesn't go away, nausea, vomiting, or pain in your upper right belly area or in your right shoulder, sudden weight gain like 2 to 5 pounds in a week, or swelling in your legs, hands, or base, and trouble breathing. So if you have any of these signs and symptoms and you're before your 20th week of your pregnancy right now, call your provider right away, make an appointment, get in that office, and talk to your doctor. Because if you don't, preeclampsia can affect you and your baby. And how is that, you ask? Well, without treatment, preeclampsia can cause serious health problems for you and baby, and it could even lead to death. You may have preeclampsia and not even know it, so be sure to go to all your prenatal care checkups, even if you're feeling okay. So health problems for women who have preeclampsia include kidney, liver, and brain damage, problems with how your blood clots. So if you do get a blood clot, it just means a mass or clump of blood forms in an area of your body and oxygen won't be able to go in and out, so that area can cause life-threatening conditions. And eclampsia is a rare and life-threatening condition when a pregnant woman has seizures or a coma. and this can also lead to stroke because the blood supply to the brain is interrupted. And so these are just a couple of pregnancy complications from preeclampsia. Another couple of complications include premature birth, or placental abruption, and vaginal bleeding. So please make sure you talk to your doctor if you do have preeclampsia so you can get it under control and get on medication. So vaginal bleeding is the most common symptom of placental abruption after 20 weeks of pregnancy. If you have vaginal bleeding during your pregnancy, just call your health provider right away. And intrauterine growth restriction is when a baby has poor growth in the womb. And this can also happen when mom has really high blood pressure that narrows the blood vessels in the uterus and placenta. And the placenta grows in the uterus and supplies your baby with food and oxygen through your umbilical cord. So if your baby doesn't get enough oxygen, they're going to have intrauterine growth restriction. Having preeclampsia increases your risk for postpartum hemorrhaging. This is a heavy bleeding after giving birth. It's rare, but if not treated, it can lead to shock and death. Basically, having preeclampsia increases your risk for heart disease, diabetes, and kidney disease later in life. And how is preeclampsia diagnosed? Well, in order to diagnose this condition, your doctor needs to test your blood pressure and your urine for protein at every prenatal visit. And if they detect any of this, high blood pressure or protein in the urine, this is an early indication of preeclampsia. Your provider can check your baby's health with a simple ultrasound because those ultrasounds will detect your baby's growth, see the measurements, and check your baby's heart rate. So you're asking, how is preeclampsia treated? Well, most women with mild preeclampsia after 37 weeks of pregnancy don't really have any serious health problems. But if you have mild preeclampsia before 37 weeks, your provider will check your blood pressure and urine every single week and monitor your baby closely. And your doctor may also want to ask you to do kick counts and track how often your baby moves. If you're at least 37 weeks and your condition is stable, your doctor may recommend that you have your baby early. This is called induction because when you induce labor, it will actually hold off on all those complications of preeclampsia during later on in pregnancy. If you are before 37 weeks of pregnancy, like around 34 weeks, then your doctor still might recommend to having the baby early by induction. And so you might either have you most likely will have a C-section. Just know that you and your baby's safety is important. It is crucial. So you can go through your entire pregnancy with preeclampsia and be absolutely okay. You can go with the high blood pressure, you can go with the high blood sugars, but in the end, just know that you and baby have to be safe. You can give birth vaginally, you can give birth with a C-section, you can be monitored closely, weekly, in fact, by your doctor, so please don't fret. Preeclampsia is scary, but again, it is common, and so don't be too alarmed if you do get it. You can just have a safe and healthy pregnancy by drinking lots of water, eating healthy foods. Fruits and veggies are your friends. Cut out those carbs and meats, and you will see a difference through your pregnancy. So I hope this video helped you today. Similar content, again, please subscribe to my channel, hit the like button, and turn on your post notifications. Thanks guys, see you in the next video.